Good afternoon to all of you as students, and my name is Sharon Metcalf, and I'm an Associate Professor of Nursing in Western Carolina University in the state of North Carolina, and that is a state in the United States, and we're located on the eastern seaboard. And we're actually speaking today from a small studio in a country town in the very pretty Blue Ridge Mountains of Barnardsville, North Carolina. And I'm meeting today with two professors from Napier, Scotland and Edinburgh, Scotland, and I know that you will know them when we meet in just a few minutes. We're here today to talk about the clinical opportunities that you will have with coming to the United States and specifically to the Blue Ridge Mountains. And today I would like to very much welcome you and talk about how this began. About 5 years ago, one of my colleagues and myself began to discuss how to have our nursing students have an international experience. And we were very fortunate to be able to have our nursing students, much like you, be able to travel specifically to the United Kingdom. And we were able to visit different hospitals, different communities at 3 different cities and locations in the United Kingdom. And specifically, we were in England, in Scotland, and Wales. And during the last 3 years, we have focused on the city of Edinburgh and Scotland due to the graciousness and hospitality of the people in Scotland. We have come each year to visit hospitals and community sites to allow our students to have the opportunity to learn about nursing and the healthcare system with the National Health Trust in the United Kingdom. While we were there on our visits, we've worked with children's hospitals in the community. We were able to meet Professor Wendy McAnally and Professor Karen Strickland from Napier University. And as we have worked together, my students from Western Carolina have been able to have clinical placements in the hospitals and community sites in Edinburgh. We found this was such an enriching and very, very cultural, engaging learning experience for my students to travel from the United States to Scotland that we wanted to be able to do this with students much like you. And I'm very happy to present Professor Wendy McAnally and Professor Karen Strickland, who will talk about opportunities that you might have with us here in this area of the United States.
Hello there, I'm Wendy McAnally. I'm a lecturer in child health nursing at Edinburgh Napier University. As Sharon has already said to you, I work in a big city in Scotland called Edinburgh, and we did meet about a couple of years ago, so we have been fortunate today to come over and explore opportunities for our students and your students, Dr. Metcalf, for an exchange reciprocal programme where students from all fields of nursing, mainly just now will be child and adult, and we're going to focus on for this time anyway, just to get started. So looking at opportunities where we could have a reciprocal exchange. So really getting excited and thinking about how this could work, and all the things that you could learn as students from here and from Edinburgh.
Hi there, I'm Karen Strickland, lecturer in adult nursing at Edinburgh Napier. I've been very fortunate to come to North Carolina to have a look at some of the clinical opportunities that are available for students from Edinburgh Napier who would like to come on an international placement to learn about the North Carolina people and their culture and the clinical expertise, learn from the clinical expertise in this area. I'll tell you a bit about a couple of placements that I've visited, and then Wendy will tell you about some of the hospital areas. One of the opportunities that would be available to students from Edinburgh Napier is to go on clinical placement to the Cherokee Indian Hospital. It's a small hospital in the mountains. It offers experience in accident and emergency nursing, outpatient department nursing, so diabetes care, respiratory care, cardiac care, and it also has a small in-bed unit as well. It's very friendly, very welcoming. There's lots of rich learning about different cultures and how people approach healthcare and looking after themselves, how they understand different illnesses. So this would offer a really valuable learning experience for you if this is the area that you chose. One of the other areas that I visited was a hospice setting. It's a hospice very much like Marie Curie Cancer Care or some of the other independent hospices within the UK. They offer the full multidisciplinary care for patients, have an in-bed unit. They also have paediatric palliative care facility. They have excellent facilities and care for families of people who are terminally ill. So this would be a wonderful opportunity for you if you chose to focus on palliative care nursing. The experience I met with the clinical nursing director there, she said that we'd be able to offer a very rounded experience for you, which would include palliative care in the community as well. So I'm confident that this would be a very rich learning experience for you if you chose to go to palliative care in the hospice setting.
The other thing that we've been very fortunate to be able to do while we were here is actually to identify international links for our students. So these would be international people that obviously that work within clinical practice that would be able to support and ensure the safety of our students, because again, you know, a lot of the students nowadays are young, they're leaving home with all these great ideas sometimes, but we've got to remember that it's got to be a safe experience for them if they're travelling here or over there. We did have exposure to the adult hospitals and the children's hospital, which was in one of the adult-based hospitals that we explored. And again, they would have opportunity to look, come and observe the care for acute patients, chronically ill patients, patients that were going to be looked after in the community when they were discharged to home. So again, very, very rich learning experience, either within the embedded hospitals or, as Karen says, within the community care. So great culture and diversity. Only wish it had been available when I was a student myself, but great opportunity. So thank you very much for having us over here. We've really learned a lot, and again, Karen and I will take this valuable learning experience back and share it with our colleagues so that they also feel inspired. Karen's been very fortunate to be part of the LTA within our Edinburgh Napier University, and she's developed a lot of good learning materials to share with the students and colleagues. And again, hopefully we could put something together so that our colleagues can understand just how valuable this learning experience has been for us.
Again, if you were able to come to our country and come to our beautiful state in this area of the Blue Ridge Mountains, what we could offer would be a unique experience with the different cultures, the different diversities of people that come to this beautiful area of the country and come for many reasons for their health care. but we would want to be able to assure you that at all times you would have someone, and it would be myself or my colleague, that would be working with you. We would ensure that your clinical placement went well and met your needs. And also some touring and some cultural trips would be included. So again, thank you for joining us today. We hope this has been an interesting meeting for you, and you can be thinking about the types of experiences that you'll have in your special module in your program. Thank you.
Thank you very much.